there's a video I've been trying to respond to, and the sync has been all whack, so I'm redoing it. Cesson Dylan did a video about nausea help. And, I have, like, severe chronic nausea. So, yeah, I have quite a lot to say about nausea and, like, things that help. So, she had mentioned ginger. And, yes, ginger is amazing. You can actually get, crystallized ginger that's, like, it's dried, but it's got sugar in it. And that can help a lot. And also, you can make different herbal concoctions or ginger drinks, or the straight root like she was talking about, or tablets at the health food store. Those things are great. My problem, though, is that I get so sick that there's not going to be any swallowing anything. Usually it has a very rapid onset, and excuse me for not, like, staring right into the camera. It's, like, dark and that light's, like, really bright, and I'm trying to look right at you guys, but that light's bothering me, so forgive me for that. But yeah, there's no swallowing anything. When my nausea hits, it's fast and it's very intense. And Pongo just went by. Tangential. Yeah, like my throat starts, it feels like it's closing, you know, and I start salivating intensely and basically just, it's horrible. It's horrible, and at that point, it's like IV or death, you know. If you're able to swallow things, then, yeah, the other thing that's good, she mentioned motion sickness and medications that help with that. There are several. The most common are, there's meds for motion sickness. There are two. There's one called Antivert, which is the brand name in the US. It's meclizine hydrochloride, and that drug, it's an antihistamine and it can help. And also scopolamine, which is usually marketed, I think, as a Dramamine in the US. It's like another antihistamine that can be helpful. And then if you can't get to a pharmacy, because I think the meclizine is usually behind the counter. Dramamine, I'm not sure, but the cheapest, best thing for nausea over the counter is actually diphenhydramine or Benadryl in the US. This is like the most effective antiemetic I've found. It's not prescription, and you can take either 25 or 50 milligrams of that every 6 hours. So I do like 25 every 3 hours. Or I used to. Now I have prescription meds, so it's not an issue. But yeah, if you're experiencing nausea, then that can work. But again, the nausea has to be mild enough, like just queasiness, that you could still swallow something in order to take advantage of oral medications. As far as prescription medications, they have now orally disintegrating tablets that you just put under your tongue, and you don't actually have to swallow anything, and that can be helpful as well if you're not triggered by like bitter drug flavors or whatever to throw up. It's all about degree, I think, with this stuff. But as far as natural therapies, there's all different things that can help. They actually sell, I think they call them C-bands or something, but they're these little wristbands that apply pressure to certain pressure points, which are supposed to help with equilibrium and nausea. I've not personally had success with these, but some swear by them. For me, a very helpful therapy is to get fresh lemon and cut it, and you carry a wedge around with you and hold it right up to your nose and inhale that. That can help as like an aromatherapeutic antiemetic motion of any kind can tend to make nausea worse. Depending again on the degree of severity, sometimes if you even just move your head, turn your head, that can make nausea get worse. So trying to, be still can be helpful as well. Everybody knows the head between the knees thing as well. If you're sitting, to just bend forward and place your head between your knees and rest. This can help some people, especially if your symptoms are from like low blood pressure, issues with orthostasis from starvation, malnutrition, or hypovolemia, like if you're dehydrated, this can be an issue as well. Then you've got your head either at the level of your heart or below, and it helps keep blood flow going, which can also help. In prescription land, there's a whole ton of stuff, and for me, 2 drugs are remarkably helpful. Promethazine, in the US it's marketed as Phenergan, and ondansetron, which in the US is marketed as Zofran. And as I was saying with the orally disintegrating tablets, Zofran does come that way. I'm not sure Phenergan does. Both can also be administered intravenously, which is the way that I take my nausea meds. And for me, like I said, because it's so severe, it's basically like inject it and then try and like not throw up in the few minutes it takes to work. But that stuff is the lifesaver for me. If I didn't have my central line and like nausea meds, I don't know if I'd still be here, to be totally. I don't think I would. I mean, it is the most brutal thing in the world, and yeah. So there are meds that can help too, especially if your condition is chronic. I definitely encourage you to talk to your doctor about it. Also, for people who are healthy, like in the first trimester of pregnancy, nausea gravidae can be absolutely brutal, and there are treatments for that as well. As a matter of fact, I just found out that there is, and what is it? I think it's a device, actually. I need to find out more about it before I talk about it. I don't know that much about it, but there also is that for especially effective in nausea gravidae, or like hyperemesis gravidarum, which is people who get so sick during pregnancy. It doesn't just come in the morning. It doesn't just last first trimester. Also, in pregnancy, they have actually found that Phenergan and Zofran are useful and generally regarded as safe in pregnancy, but definitely talk to your physician about it if you are pregnant and experiencing significant distress from nausea and vomiting. Yeah, that's just a little side note, just in case anybody finds this video who doesn't have a chronic condition all the time. Driving. I meant to talk about driving because Sasan talked about that, and she was saying how she needed to be in the front seat facing forward. I will second that, although in my case, there's no being a passenger in my universe. Like, I have to drive. There's something about being connected with the car, so that we're moving as one, so that somehow my body is better able to anticipate the movements of the car, and like feel one with the vehicle, and like know, like if I turn the steering wheel a little bit, somehow my body knows to like, okay, it's gonna turn, and I can adjust a little bit. Yeah, so there's no being a passenger for me in the car. I have to be the driver. There's just something that's different about being connected to the car. You know, you kind of feel one with the vehicle when you're in control of it, and your responses are more, hand-eye coordinated and movement anticipatory. Anticipatory? Is that a word? Anticipation of movement coordinated. So, like, if I turn, I know how the car is going to move, and if I step on the gas or step on the brake, I know the car's going to move. If you're not in control of the motion and not in sync with the motion, nausea is a lot worse. So definitely try being the driver. That helps me a great deal. The other thing that helps is I have to have air on my face. Like, even, the cooler the better. I guess it doesn't have to be cold air, but I definitely need that airflow. Like, just cracking the window isn't enough. I have to actually feel air on my face. For some reason, that helps me a lot in the car. And then, of course, nausea meds before trips and stuff. Rare occasions when I've had to be the passenger, I will inject both meds, and, like, it's still a fight. I am just miserable. Like, there's been a couple times where there was just no choice, and, oh, man. It's bad news. One other issue I want to talk about with nausea is opiate therapy or medications. Like, if you take medications that make you sick. Again, there's a lot of great meds on the market for that. Phenergan, Zofran are used a lot. For an opiate therapy, I'm actually going to give you a little nerd trivia here. The pain center in the brain is right next to, there's a place in the brain called the chemoreceptor trigger zone. And this is something that will, is usually stimulation of the CTZ, which will cause med-related nausea. There's actually 3 ways you can get nauseous. There's learned nausea, like you grow up and sociocultural environmental influences tell you certain things are gross. Like, this smell is bad, or this thing is bad, or like in Asia, they eat a lot of insects. Here, we'd be ewed out by that. Maybe watching somebody do it make us queasy. That's like learned nausea. And then there's chemical nausea, which is like in the case of drugs like opiates. Would stimulate the chemoreceptor trigger zone in the brain. And then there is actual physical, like GI irritation, nausea. That can actually happen from some drugs as well. Also, like if you get a stomach virus, the bacteria will release a GI irritant that will cause your body to want to purge, usually from both ends. Not fun. I've had those. They're brutal. You just don't know which end to put over the toilet, and it's just a TMI gross fest of, like, all you want to do is die. Oh man, stomach viruses. But yeah, so those are the 3 kinds of nausea. If you were ever curious, More Than You Ever Wanted to Know by A.G.E. I do that a lot. But yeah, if you're unfortunately, a lot of doctors, when prescribing pain medication, when prescribing opiate pain medication, do not address the nausea issue, and a lot of people get really screwed up by this. And it really pisses me off. It shouldn't be the case. It's very well known that opiates can cause nausea. The worst situations are like after dental surgery or after any surgery where you need those pain meds and then they make you sick. So you don't want to take them because then you're going to be nauseous and in pain. Or worse, if you've had oral surgery, if you throw up, you're going to contaminate your wound. So there's like all these just no-brainer situations where clinicians don't prescribe antiemetics when they should. I'll have to do a whole rant about that. Actually, I guess I just did a mini one. But if you ever need opiates for any reason, ask for nausea meds. Seriously, especially surgery. There's nothing worse than getting home from surgery and needing your pain meds and getting sick, and it's the middle of the night and you don't have any nausea meds and you don't know what to do. So, yeah, it's worth it. If you're ever in that situation, pardon me, my eyes are really itchy. As I mentioned before, the best OTC thing to do is Benadryl, either 25 milligrams every 3 hours or 50 every 6, depending on what works best for you. Most pain meds are dosed every 4 to 6 hours. So if you're doing every 4 hours, maybe take the 25. If you're doing it every 6 hours, then go ahead and do the 50 every 6 if you want. Everybody's different. It's not the best, but it's the best without a prescription that you can find at any hour. So Benadryl, that's diphenhydramine, is the generic. Really good for nausea, and this video is getting way too long, so I'm going to publish this.